In this video, you will learn about guidelines from the Centers for Disease Control and Prevention to reduce the risk of spreading COVID-19 in agricultural workplaces. The CDC has issued guidance to protect farm owners, operators, workers, and families from COVID-19, short for Coronavirus Disease 2019. Agriculture work sites, shared worker housing, and shared worker transportation vehicles present unique challenges for preventing and controlling the spread of COVID-19. Consistent preparation and prevention measures can help reduce the risk of spreading COVID-19. Workers on farms, ranches, and other production agriculture work sites are considered critical infrastructure workers in the food and agriculture sector. All agriculture work sites should follow, as feasible, relevant aspects of this CDC guidance. Additionally, they should work directly with appropriate state and local public health officials and occupational safety and health professionals. This presentation is based on CDC guidance of what is currently known about COVID-19. The CDC and the U.S. Department of Labor will update guidance as needed and as additional information becomes available. Please check the CDC COVID-19 website periodically for updated guidance. The Southeastern Coastal Center for Agricultural Health and Safety is part of a national network of 10 other agricultural health and safety centers funded by the CDC's National Institute for Occupational Safety and Health. These centers conduct research, education, and prevention projects to address health and safety issues in the agriculture, forestry, and fishing industries. The Southeastern Coastal Center was established to address pressing agricultural health and safety issues throughout the southeastern coastal states, the U.S. Virgin Islands, and Puerto Rico. The center has a COVID-19 webpage with fact sheets, PowerPoint presentations, translated materials, and important website links to provide information and resources that will help you prepare for and prevent the spread of COVID-19. Visit http://www.sccahs.org/index.php/COVID-19 for these resources. So, what is COVID-19? COVID-19 is a respiratory illness. Symptoms often include a fever, cough, shortness of breath or difficulty breathing, headache, chills, muscle pain, sore throat, or new loss of taste and smell. Workers at higher risk for severe illness include older adults and people of any age with certain underlying chronic medical conditions, like chronic lung disease, severe obesity, diabetes, or serious heart conditions. The implementation of policies and procedures addressing issues related to workers at higher risk of severe illness from COVID-19 should be made in consultation with licensed healthcare and human resource professionals. The virus is thought to be spread mainly from person to person when people are in close contact with one another within about 6 feet and through respiratory droplets produced when an infected person coughs, sneezes, or talks. Studies indicate that people who are not showing symptoms can still spread the virus. It may also be possible that a person can get COVID-19 by touching a surface or object that has the virus on it, and then touching their own mouth, nose, or possibly their eyes. Based on the limited information available to date, the risk of animals spreading COVID-19 to people is considered to be low. It is important to understand the distinctive factors that affect farm workers' risk for COVID-19 in production agriculture workplaces. The three main factors that affect a worker's risk level include distance between workers, type of contact, and duration of contact. The first factor is distance between workers. Farm workers often have close contact to one another in the fields and indoors. Workers may also be near one another at other times, such as when clocking in or out, during breaks, when sharing transportation or in shared housing. The second factor is the type of contact. Farm workers may be exposed to COVID-19 through respiratory droplets in the air. For example, when workers who have the virus cough, sneeze, or talk. Exposure could also occur when workers have contact with contaminated surfaces or objects, such as tools, equipment, tractors, workstations, toilet facilities, or break room tables, and then they touch their own mouth, nose, or possibly their eyes. This is not thought to be the main way the virus spreads. The third factor is duration of contact. Farm workers often have prolonged close contact with coworkers, both on and off the work site. Continued contact with potentially infectious individuals increases the risk of COVID-19 transmission. The additional factors that increase risk of farm workers becoming infected with and transmitting COVID-19 include sharing transportation, such as rideshare vans or shuttle vehicles, carpools, and public transportation. Living in employer-furnished housing and sharing living quarters. Cooking and eating areas, bathrooms, and laundry facilities with fellow workers. Living in crowded and multi-generational housing. Having contact with their households or families and with fellow workers in community settings and areas with ongoing community transmission. The mobility of the workforce who, in moving from farm to farm, can potentially spread the virus between communities. And poor access to clean water for hygiene purposes throughout the day. Farm owners and operators can prevent and slow the spread of COVID-19 by taking time to stop, think, and act for safety. Owners and operators should develop a COVID-19 assessment and control plan to protect themselves and farm workers in accordance with the CDC guidance. State and local health departments may also provide resources to aid in the development of these plans. A control plan should reflect the specific region, worksite space, job tasks, and other features of each farm, ranch, nursery, orchard, or other agricultural location. Those involved in the work can best set priorities and assess how realistic these recommendations are for specific situations at their facilities. Owners and operators should designate a qualified workplace coordinator who will be responsible for COVID-19 assessment and control planning. All workers should know how to contact the identified coordinator with any COVID-19 concerns, and the coordinator should handle such concerns confidentially as appropriate. The workplace coordinator should have a means to communicate in the preferred languages spoken or read by the workers if possible, and provide materials at the appropriate literacy level. Farm workers should also be provided with contact information about where to get COVID-19 testing. Consider screening farm workers for COVID-19 signs and symptoms. Uniform policies and procedures for screening workers should be developed in consultation with state and local health officials and occupational medicine professionals. Possible options to screen workers for COVID-19 symptoms could include screening prior to entry into the work site, or if possible, before boarding shared transportation. Asking workers in appropriate languages if they have had a fever or feelings of feverishness, respiratory symptoms, or other symptoms in the past 24 hours. Checking temperatures of workers at the start of each shift to identify anyone with a fever of 100.4 degrees Fahrenheit or greater, or reported feelings of feverishness. Not letting employees enter the workplace if they have a fever of 100.4 or greater, or reported feelings of feverishness, or if screening results indicate that the worker is suspected of having COVID-19-like symptoms. Encouraging workers to report symptoms immediately when on site. Ensure that personnel performing screening activities, including temperature checks, are appropriately protected from exposure to potentially infectious workers. In most cases, the preferred approach is to eliminate a hazard or hazardous processes, like excluding sick workers and visitors, to install feasible engineering protocols, and to implement appropriate protocols for cleaning, disinfection, and sanitation. This further reduces exposure to farm workers. Until such controls are in place, or if they are not effective, other administrative control measures and personal protective equipment, also known as PPE, will be needed.
Assess and identify opportunities to limit close contact with others. One way of doing that is to maintain a distance of at least 6 feet between people whenever possible. This includes owners, operators, farm workers, supervisors, crew leaders, delivery personnel, and anyone else entering the agricultural workplace. Possible options to develop physical distancing practices on the farm include reducing crew sizes, staggering work shifts, meal times, and breaks, alternating field rows, remaining 6 feet apart, alternating normal shift schedules so workers are always around the same coworkers, removing or rearranging chairs and tables, or adding visual cue marks in employee break areas to support social distancing between farm workers. Farm workers may have limited control over their environment in some employer-furnished housing. Family members should be kept together in housing facilities. When a 6 feet distance between farm workers is not possible, the CDC guidelines should suggest installing shields or barriers, such as plexiglass, between farm workers and encouraging farm workers to wear cloth face coverings. Farm owners and operators should develop sanitation protocols for daily cleaning and sanitation of work sites and high-touch areas, such as tools, equipment, and vehicles used by farm workers, using CDC guidance on cleaning methods. In addition, they should follow the manufacturer's contact time recommendations to make sure disinfectant solutions remain on surfaces for the recommended time. Since children may be present on the farm, plan how to keep cleaning chemicals, including hand sanitizers, out of reach of children. Choose disinfectants or alternative cleaning methods, for example, soap and water, for surfaces with which food comes into contact. Use gloves made of lightweight nitrile or vinyl, or heavy-duty rubber work gloves that can be disinfected. Farm workers may also need gloves, face protection, and eye protection when cleaning and disinfecting. What if I don't have access to an N95 respirator? The CDC recommends wearing cloth face coverings as a protective measure in addition to staying at least 6 feet away from others. Cloth face coverings may be especially important when social distancing is not possible or feasible based on working conditions. A cloth face covering may reduce the amount of large respiratory droplets that a person spreads when talking, sneezing, or coughing. Cloth face coverings may prevent people who do not know that they have the virus that causes COVID-19 from spreading it to others. Cloth face coverings are intended to protect other people, not the wearer. Cloth face coverings are not PPE. They are not appropriate substitutes for PPE such as respirators, like N95 respirators, or medical face masks that are used in workplaces to protect the wearer. While wearing cloth face coverings is a public health measure intended to reduce the spread of COVID-19 in communities, it may not be practical for workers to wear a single cloth face covering for the full duration of a work shift in agricultural operations if they become wet, soiled, or otherwise visibly contaminated during the work shift. If cloth face coverings are worn in these operations, employers should provide readily available clean cloth face coverings or disposable face mask options for workers to use when the coverings become wet or soiled. Social distancing will be very important when use of cloth face coverings are not feasible. Some examples of why cloth face coverings are not feasible include the extended period time required to wear the covering, hot, humid environments, situations that require touching of the face and repositioning of the coverings, and frequent removal and replacement of the coverings for water or nourishment breaks. In such instances, employers may also consider providing workers with alternatives to cloth face coverings, such as face shields. Employers who determine that cloth face coverings should be worn in the workplace, including to comply with state or local requirements for their use, should ensure the cloth face coverings do the following: fit over the nose and mouth and fit snugly but comfortably against the side of the face, are secured with ties or ear loops, include multiple layers of fabric, allow for breathing without restriction, and are not worn by anyone with trouble breathing, can be put on and removed by the wearer without help, do not lead to heat-related illness. Face coverings also need to be laundered using the warmest appropriate water setting and machine dried daily after the shift, without damage or change to shape. A clean cloth face covering should be used each day. They also should not be used if they become wet or contaminated, and they need to be replaced with clean replacements provided by the employer as needed. Face coverings are not shared among workers unless adequately laundered between uses. They are handled as little as possible to prevent transferring infectious materials to the cloth, and they are not worn with or instead of respiratory protection when respirators are needed. You should clean your face coverings after each use. Contaminated cloth face coverings should be removed in a safe manner and disposed of or regularly cleaned in a washing machine after each use. And don't share cloth face coverings among workers unless the coverings are adequately laundered between uses. To help contain the virus, the CDC recommends these practices: covering your coughs and sneezes with a tissue, throwing away used tissues immediately. If you don't have a tissue, cough or sneeze into your elbow, not your hands. Make it easy for farm workers to protect their health and safety on the job. Add extra hand washing stations and make hand sanitizers, cloth face coverings or masks, and disposable gloves available and accessible. Encourage farm workers to wash their hands often with soap and water for at least 20 seconds. Farm workers must have reasonable access to permanent or temporary hand washing facilities equipped with soap, potable water, and clean single-use towels. Easy access is especially important in areas where multiple farm workers are working. Increase the number of hand washing stations to minimize the distance to a station and the likelihood of crowding at stations. These sanitizing stations should be in multiple locations on the farm if feasible, such as the point of entry or exit to a farm field, the location where farm workers clock in and out, and made available to workers in field settings. In addition to increasing the frequency of hand washing, if hands aren't visibly soiled or dirty, farm workers can use hand sanitizer containing at least 60% alcohol, rubbing their hands until they are dry. You should wash your hands before eating food or touching your eyes, nose, or mouth, before and after treating a cut or wound, after using the toilet, after blowing your nose and covering your cough or sneeze, after touching an animal, animal feed, or animal waste, after being in a public place, and after touching something often touched by other people, like doorknobs or equipment. Tools vary by agricultural production, but examples include shovels, hoes, rakes, grates, gates, saddles, and animal harnesses. Where possible, do not share tools. If tools are used by multiple employees, They should be cleaned and disinfected between each employee and use if possible. If cleaning and disinfecting tools after each use is not possible, daily targeted and more frequent cleaning of shared equipment and tools is needed. In such cases, workers may also need to use gloves when handling shared tools and equipment. Dispose of all cleaning material and non-reusable PPE in compliance with OSHA standards to prevent the further spread of COVID-19. Keep shared spaces clean. Conduct targeted and more frequent cleaning and disinfecting of high-touch areas of shared spaces like time clocks, bathroom fixtures, vending machines, railings, and door handles. Possible options may include cleaning and disinfecting break areas between each group using the areas as well as daily, cleaning and disinfecting locker rooms at the end of each shift, providing disposable disinfectant wipes or other appropriate disinfectant supplies and required PPE to use these safely so that commonly touched surfaces can be wiped down as needed. Keep shared spaces clean. Use disposable disinfectant wipes and required personal protection equipment or PPE to frequently wipe down touched surfaces. Training workers during a pandemic can pose some challenges because this is new for many of us. As part of their hazard assessments, owners and operators should consider whether PPE is necessary to protect workers. This is especially important when engineering and administrative controls are difficult to maintain and there may be exposure to other workplace hazards. Use PPE training videos or in-person presentations, but be sure to observe physical distance recommendations. Ensure PPE is used properly by all farm workers. Farm workers who have frequent or close contact within 6 feet with coworkers who may be infected with COVID-19 are in the medium risk exposure category. Medium risk workers rarely are required to use respirators for infection control. As is always the case when respirators are not required to protect workers, owners and operators may consider allowing voluntary use of filtering facepiece respirators such as N95s if workers wish to provide and use such equipment on their own. Owners and operators who allow voluntary use of respirators should ensure they comply with the voluntary use provisions of the OSHA Respiratory Protection Standard. Be aware that the use of filtering facepiece respirators may increase the risk of heat-related illness. Owners and operators should adjust water availability and frequency of breaks as appropriate whenever workers are at risk of heat-related illness. Workers should immediately be separated from others at the workplace, sent to their permanent or temporary housing arrangements, or, when they can't be isolated in their existing housing arrangement, placed in alternative housing arrangements under quarantine away from other workers if they appear to have a fever, cough, shortness of breath, or have 2 or more of the following symptoms: chills, repeated shaking with chills, muscle pain, headache, sore throat, or new loss of taste or smell. Sick workers should be provided with informational resources to access medical attention should they need it. One such resource may be the Health Resources and Services Administration, HRSA, which identifies HRSA-funded health centers. These health centers can assess whether a patient needs further evaluation, which may be done over the phone or using telehealth. Individuals may also receive primary health care services at their local health center at a reduced cost or free of charge depending on their economic status. Most people with COVID-19 will have mild illness and can recover at home. Since we don't know for sure which animals can be infected with the virus that causes COVID-19, sick workers should stay away from animals, including livestock and pets, during their illness. If a worker is confirmed to have COVID-19, owners and operators should consider ways to inform anyone at the work site to the extent it is reasonably knowable who has been in sustained close contact with that worker of their possible exposure to COVID-19 based on the CDC public health recommendations for community-related exposure. However, the owner should protect the infected worker's confidentiality and not identify them, as required by the Americans with Disabilities Act. If a worker becomes or reports being sick, clean and disinfect the work area, equipment, common areas used, including break rooms, bathrooms, and vehicles, and any tools handled by the symptomatic worker. If a worker is in an employer-furnished housing, consider providing a dedicated space for the worker to recover away from others, and then clean and disinfect living quarters, cooking and eating areas, bathrooms, and laundry facilities. Do not allow other workers to use these areas until they have been cleaned and disinfected. A worker going to a home in the community can be provided with guidance to mitigate the risk of transmission in the home. Most importantly, in employer-furnished housing, the owner or operator should provide a dedicated and segregated space for sleeping quarters, kitchens, and restrooms for farm workers with confirmed or suspected COVID-19 to recuperate without infecting others. Consultation with an occupational health provider and state and local health officials will help owners and operators develop the most appropriate plan for addressing when employees can discontinue isolation and return to work. The following considerations should apply to all types of transportation to and from the agricultural worksite. Provide as much space between riders as possible. Group workers in the same crews or who share living quarters together when transporting. Increase the number of vehicles and the frequency of trips to limit the number of people in a vehicle. Make hand washing or hand sanitizer available and encourage riders to use hand hygiene washing or sanitizer before entering the vehicle and when arriving at the destination. Instruct riders to follow coughing and sneezing recommendations when in the vehicle. Highly encourage all passengers and drivers to wear cloth face coverings when in the vehicle. Transportation vehicles should be cleaned and disinfected in accordance with CDC guidelines for non-emergency transport vehicles before and after each trip or daily at minimum. Most children are home now because K-12 schools, childcare, and summer programs have been shut down or canceled because of COVID-19. However, the CDC says even when homes and work sites overlap, continue to restrict children from the work site. Taking a child into the work site not only exposes them to hazards like chemicals and equipment, but also can distract workers and lead to incidents. Advise farm workers to continue sending their children to childcare while they are working on the farm if possible. Establish and enforce policies for farm workers that restrict children from work sites. If childcare programs and K-12 schools are not open, the work site is not an acceptable alternative. If youth work on your farm, assign age-appropriate tasks. Follow child labor laws, provide extra supervision, and teach young workers about ways they can protect themselves, such as using PPE and physical distancing. It is also recommended to hang posters on COVID-19 topics in many places where your farm workers can see them. The CDC has free, simple posters available to download and print, some of which are translated into different languages. You can download the posters at bit.ly/CDC posters. Again, this presentation was based on CDC guidance on what is currently known about COVID-19. For the CDC's recommendations for the agricultural workplace, please visit the web address you see on this screen. We hope this video has been helpful in answering questions you may have about how to reduce the risk of COVID-19 in the agricultural workplace. The Southeastern Coastal Center for Agricultural Health and Safety also has more resources at the website on the screen to help you. The center has a series of brief videos in English and Spanish on hand washing, face coverings, and other topics. This presentation has a PowerPoint slide set and fact sheets in English and Spanish. All of this to help you and your workers implement measures to prevent and control the spread of COVID-19.